Oral sex and oral health. The science behind the risk. Oral sex is often considered low risk, but medical research shows that several infections can enter and spread through the mouth. Let's look at what the evidence actually says. Why this topic matters. Oral sex is widely practiced across many age groups. Because it involves direct contact with mucosal tissues and bodily fluids, it carries real but often underestimated health risks. Importantly, medical studies confirm that absence of symptoms does not equal absence of infection. The mouth as a site of infection. The oral cavity contains delicate mucosal surfaces, dense blood supply, and immune cells. Minor injuries from brushing, gum disease, or inflammation can allow microorganisms to enter the body. Research shows that sexually transmitted infections can establish infection in the mouth or throat, be transmitted from genitals or anus to mouth, be transmitted from mouth to genitals. Risk depends on multiple factors: type of pathogen, presence of sores or bleeding, exposure to bodily fluids, frequency of exposure, use of protective barriers. Why some infections spread easily. Saliva alone is not highly infectious for most STIs, but contact with genital secretions, blood, or rectal fluids increases risk. Coexisting oral conditions such as gingivitis, ulcers, or dental infections further increase susceptibility. Oral manifestations of sexually transmitted infections. Medical literature identifies several STIs that can affect the mouth and throat. Herpes simplex virus, HSV. Herpes spreads through direct contact. Oral infection commonly causes painful blisters or ulcers. Once infected, the virus remains dormant and may reactivate periodically. Human papillomavirus, HPV. HPV is among the most common sexually transmitted viruses worldwide. Certain strains infect the mouth and throat and are strongly linked to oral pharyngeal cancers. Most infections cause no symptoms. Why early detection is difficult. A major clinical challenge is that many oral STIs remain asymptomatic. When symptoms appear, they may include mouth or throat ulcers, red or white patches, swollen lymph nodes, sore throat, or difficulty swallowing. This is why dental exams and screening play a critical role. So far, we've seen that the mouth is not protected from sexually transmitted infections and that many of these infections spread silently. Oral health and sexual activity, prevention, treatment, and evidence-based guidance. Earlier, we explained how infections can enter through the mouth. Now let's focus on which infections matter most, how to prevent them, and what treatment actually works. Bacterial infections affecting the mouth. Syphilis. Syphilis is caused by Treponema pallidum. Oral infection can present as painless ulcers weeks after exposure. Without early antibiotic treatment, it can progress to serious systemic disease affecting the heart and nervous system. Gonorrhea and chlamydia. These bacteria can infect the throat and often cause mild or no symptoms, making them easy to miss. Untreated infections can still spread and lead to complications. Viral infections of concern. HIV. Large epidemiological studies confirm that HIV transmission through oral sex is significantly lower than vaginal or anal intercourse, but not zero, especially when oral sores or bleeding gums are present. Hepatitis viruses. Hepatitis A may be transmitted through oral anal contact. Hepatitis B can spread through sexual fluids. Hepatitis C is less commonly transmitted sexually, but remains possible. Vaccines are available for hepatitis A and B and are strongly recommended for at-risk individuals. Fungal infections. Oral candidiasis is caused by overgrowth of Candida albicans. While not classically classified as an STI, intimate contact can contribute under conditions of immune imbalance or antibiotic use. Evidence-based prevention strategies. Public health research supports several effective measures: barrier protection during oral sex, avoiding oral contact when sores or bleeding are present, regular STI screening based on risk, routine dental checkups, HPV and hepatitis vaccination when indicated. These strategies significantly reduce transmission risk. Treatment. What medicine recommends? Treatment depends on the cause. Bacterial infections leading to antibiotics, viral infections to antiviral therapy or symptom management, fungal infections to antifungal medications. Early diagnosis improves outcomes and reduces spread. Benefits versus risks. What science actually says. Some studies suggest sexual activity may reduce stress and promote emotional bonding through neurohormonal effects. However, these benefits do not negate infectious risks. Safe practices remain essential. Final takeaway. Oral sex is common, but it is not risk-free. Scientific evidence clearly shows that infections can be transmitted through the mouth, often without symptoms. The good news is that education, prevention, vaccination, and early treatment are highly effective. If you found this information useful, like the video, share it with someone who values accurate health information, and subscribe for more evidence-based medical education.